welcome back to this segment of Eye on St. Louis. If you have a child going to school for the first time, you have probably already started the childhood immunization process. Immunization against childhood diseases like measles, chickenpox, and polio can prevent serious illnesses and in some cases death. Only 75% of our nation's children are currently fully protected with the 4-DTP3 polio series vaccine. And in other areas, levels of vaccine coverage for some of the more recently introduced vaccines, such as hepatitis A, are even lower. Joining me to talk about what you can do to protect your child against preventable childhood diseases are Dr. C. William Chinoli. Dr. Chinoli is the Executive Director for the Latino Community Health Center here in St. Louis. Also joining us in this segment is Angela Brown. And Angela is the Manager for Community Relations for Care Partners. Also joining is Grant Beavers, Dr. Grant Beaver, and he is a volunteer physician for the Latino Community Health Center. Welcome to Eye on St. Louis. Glad to have you join with us. Why don't we start with you, Dr. Chinoli, and sharing with our viewing audience something exciting that's going on there at the Latino Community Health Center in South St. Louis, and it's going to be free immunization for our children, right?
Yes.
And you feel that it's a social commitment for the community to get this awareness out?
Yes, because our people is responsible for other people.
Absolutely.
We begin our organization in '93 in relation to all Latino peoples. We live in San Luis area. You know, we speak 3 different languages and 250 different dialects. And our organization, all our team in our organization are minimum bilingual or trilingual.
Now, is there a large a group of Latinos here in the St. Louis area?
Yes.
Such as about how many, approximately?
Well, in Metro, it is 35,000 now.
Okay.
The Hispanic Latino population increased 2 times in between 1990 to 96.
So what you're really wanting to emphasize is the importance of getting our young children immunized and the partnership that the Latino Health Center has with the Care Partners and also with the City of St. Louis Health Department in making this happen, right?
Yes, because we try to jump the language barrier.
Yes.
Many people, many mothers or parents don't go to immunization because don't understand the English, don't understand the system, or I can't to talk by phone.
Yes. So is that a part where Care Partners is helping with that situation, Angela?
Yes, Mary, it is. When Dr. Chignoli approached Care Partners with this idea of a massive immunization campaign, we were very excited because Care Partners is the Medicaid division of Partners HMO, which is owned by BJC Health System. Part of our corporate mission is to help improve the health status of the communities that we serve. And so when he brought this idea, we were very eager to partake. And I think that all companies, organizations, social service agencies, we all should get involved in this very important initiative. I know that Care Partners was very involved and actually underwriting some of the marketing activities, such as posters, flyers, and direct marketing efforts. So everyone should really get involved in this very, very important social issue.
That's great. And your role, Dr. Beaver, as a volunteer physician helping there, is to make sure that parents get in and get the children immunized. Because I was reading some statistics, and it said that preventable childhood diseases strike thousands of unprotected children, even causing death, and that only 75% of children nationwide are fully protected?
That's correct. And my experience has been that most of the Latino population
comprise a lot of that population?
That's correct. There's an inordinate percentage of the population that have these mishaps because of lack of immunization. And so there's no question that within the Latino population it's extremely important that this be propagated and that the immunizations, the percentages we brought up. My experience to date has been that essentially a very low percentage of the population is immunized completely as they should be from the population that we serve.
And now, one of the other areas that we're also interested in, and you probably can add to that, Angela, is that it also helps reduce healthcare costs because it makes children less susceptible to the debilitating diseases?
Absolutely. I know that being an HMO, we are very concerned from a fiduciary perspective as well as a humanitarian perspective, these issues of immunization. But of course, it does decrease healthcare costs when you can really emphasize prevention as a mechanism for healthcare. So absolutely, this does help curb healthcare costs.
Now, also, you said that the vision of the Latino Health Center there is to bring in the Christian ministry as well, Dr. Janelle?
Yes, but probably the most important thing about our immunization campaign is we try to create integration inside the entire population and probably inside the minority people, because the Hispanic Latino population live inside the African American population and Asian American population. It's very interesting how the people can to go together to the clinic and receive the same good services and begin to develop friendship.
Now, also, you have other programs as a part of this. Of course, the child immunization is what we're really pushing, and we want to give a phone number later in our segment that viewers can call so they will know all of the proper documentation needed to have this done. And the phone number is on the screen now that viewers can call the 351-5700 for the additional information. But you also, as well, have other family transitional type programs?
Oh, yes.
Okay.
We have, we begin in prenatal care. We give education to the mothers and different.
We want to thank you for coming on and sharing information with our viewers, and we will again give the phone numbers as we go to our break. Again, thank you so very much for sharing information. Thank you for joining us for this week's edition of Eye on St. Louis. We'd like to hear from you. Write us right here at Channel 4. Our address is on the screen. And again, we thank you for joining us. We'll see you next week. Have a very good day. Bye-bye.